Yes, so I will be talking today, as I mentioned, about Weqaya food specifications. Next slide, please. So we all know that healthy eating habits can actually prevent the major burden of diseases. So what do we do in public health actually? In public health, what we do, we measure the morbidity and we measure the mortality. What I mean by morbidity is like the major causes of diseases. What is causing the major rates of death? What is causing diseases? And unfortunately, chronic conditions come as number one, including heart disease, diabetes, hypertension, and obesity. Obesity can lead also to other side effects. So how do we combat that? How do we combat chronic conditions? We have several things that we actually doing, and the Department of Health doing, the health sector is doing, but also there is a major part that we can help you achieve, which is actually maintaining a healthy lifestyle. And one of the main pillars of a healthy lifestyle is healthy eating. And with healthy eating, we can prevent type 2 diabetes, we can prevent cardiovascular diseases, among others. And why type 2, not type 1? Because we know that type 1 is mainly comes with children and it affects the pancreas, and there is not much, unfortunately, that can be done other than taking the medications and leading also a healthy lifestyle. But type 2 diabetes, actually, it can be even cured with a healthy lifestyle, with following a healthy diet, eating the healthy food, and so exercising. It can even be cured. So it is that essential, actually, to follow a healthy lifestyle for people who have type 2 diabetes, who have dyslipidemia, have hypertension, and so on. So as you can see here, this is actually done by the World Health Organization. It is an old slide, as you can see. It says 2005, but this doesn't mean that it is actually not the same. It's still the same. And we have risk factors. We have risk factors that modifiable, and we have unmodifiable risk factors. What I mean by the unmodifiable risk factors is the environment that you are in. You can't change the environment. You can't change your sex if you are male or female. You can't, unfortunately, change your age. I wish we can go back a few years and be younger, but we can't change that. And we can't change our genes, as I said. But if there are things that we can change, then let's work on them. And what I mean by things that we can change our diet, eat a healthier food, we can be more physically active. The recommendation is to be active between 30 to 60 minutes a day, 5 days a week, and for children, even 1 hour a day. And of course, we don't want to exert ourselves, but if we do like 30 to 1 hour, this will be. And by doing that, by following those, we will be able to actually work on our blood pressure. We know that salt, my colleague Arwa Al Modwahi, she will be talking to you about the importance of reducing salt in our food, because this helps with the blood pressure. We can work on our diet to improve our sugar levels, reduce the insulin, because high insulin also can have major side effects as well in the body, and the abnormal lipids as well. So this, we can fight overweight and obesity. And with that, as I mentioned in the beginning, that the chronic diseases are actually the major risk factors. So with that, we can prevent stroke, hopefully, some kind of cancer. I'll give you an example of a very proven cancer that can be prevented, which is colon cancer. Colon cancer, for people who are not eating enough fibers and not watching their diet, it can be high risk. So we have to have anywhere between 20 to 30 grams of fiber a day. For males, it's higher. For females, it's a little lower. But we need to concentrate on food that is high in fiber to prevent those kind of cancer. Even there are studies that show that there is some relation actually with cancer and breast cancer and other types of cancer. And as I mentioned, diabetes, now chronic respiratory diseases, it's mainly the environment and smoking. And our colleagues at the Abu Dhabi Public Health Center are working hard on tobacco use and to prevent smoking from all kind of smoke, to be able to control the respiratory diseases. Okay, so now my concentration today will be about, can you go back to, sorry, the slides are moving by themselves. Yeah, yes, this one. So we need to work about the slide, yes, about Weqaya food specifications. So what are Weqaya food specifications? Actually, what it is, those are specifications that we look at international evidence, and we look at what kind of food, what kind of ingredients within the food, that we rank them, we classify them, and see what is the nutritional composition of it and how is it actually related to health. So the major thing is the relation between food and health that we are looking at. And certain diets are determined by things, yani actually the nutrients and other nutrients quality as well. So even like now, today we're going to talk about Weqaya, about what is in the food, but there are other determinants in the nutrient quality that can affect our health as well. So Weqaya is only concerned with nutrients. It doesn't look at sustainability, it doesn't look at price, it doesn't look at environment. So maybe those will be, I would say, the cons. But the pros of it is that it does look at the nutrition composition of the food. So Weqaya specification development is actually it's identifying nutrition-related public health problems. So as I mentioned, we look at what is the major health problems, and we establish that it is hypertension, it is obesity, and it is actually dyslipidemia. So that's why we look at the calories, and I'm going to go into more details. We look at the fat content, we look at the salt, at the sugar content, and we look at how these the nutrient recommendations actually how they are related to the food-based dietary guideline. Now, each country in the world have its own food-based dietary guideline. And our colleagues in the Ministry of Health now started establishing the food-based dietary guideline for the United Arab Emirates, and we are working with them, and we are, giving our input as well. So the other thing about Weqaya, it identified possible intervention. And also, it is very important that when we start any project, it doesn't have to be just this one, is to convene a project group. A group actually that has people from the government entity, it has nutritionists, it has people from the public and the private sector. Now, when we started with Weqaya, we actually looked at different models. We looked at other examples. Weqaya is not specific just for the UAE or for Abu Dhabi. Weqaya it's all over, actually. When we looked at it, we did our research, we found out that you can find similar programs in other countries. Like, for example, in the US, they use the heart check program. In the UK, they use the traffic light system. In Australia, they also use what they call the check, and they use in the Netherlands, Scandinavian countries, they use the keyhole symbol. One interesting thing about the keyhole symbol, if you see the circle and you see the pyramid, this comes from because we know that years ago we used to look at the pyramid and then we used the plate, and that's where the keyhole symbol is coming from. So now I'm going to concentrate a little bit about the keyhole symbol, because actually, can we go to the previous slides, please? After this one. Yes, why am I looking at it? Because we discovered that it has very much similarities to the Weqaya in terms of the specifications, how much fat, how much salt, how much sugar, etc. And when was that established, though? This was established years ago, way before we started, way before, not me, but some of my colleagues were even born. And this is in 1989. And so it's been a while there. And as you can see from the next slide, because it's been around for a long time, see how many products there are. There are like 2,500 products. There are in Sweden, there are around 600 in the Denmark and Norway. Restaurants have it, kitchen have it, and awareness also shows like almost 95% of people are aware of this program. So if you go to Sweden and you go to any supermarket, you will see the keyhole symbol all over the place. You will see it on healthy food items, on a Better Choice drinks, Better Choice milk. You will see it even in the delis, on sandwiches, fruits and vegetables, and so on. So now we are going to talk about our program, which is Weqaya. Please note that, yeah. Yes, so Weqaya is part of services. Weqaya started in 2007 as a services, actually, that it was part of the health insurance TIQA, where it did a lot of testing in hospitals, and it was covered for nationals to find out what are the major health risk programs. And then it grew, it became also part of smoking cessation, and then it grew, it became part of food. So now for food, Weqaya allow all restaurants, food manufacturers, producers, supermarkets, that they can add this logo that you can see up there, that is like the word Weqaya. And Weqaya, for you who don't speak Arabic, means prevention. And there's a say by Prophet Muhammad, peace be upon him, that prevention is better than cure. And that's why we're using this word Weqaya, and the green heart that circles, that shows that it actually prevents heart diseases. So different nutrients are combined, and actually, as you can see, we identified foods and what's a better choice food, like if it's a low in fat, and if it's less salt, less sugar. And the other thing, it is voluntary, but only in food outlets like restaurants, groceries, and so on. But when it comes to healthcare facilities, and I will be explaining more, so for you, please, those who are working at healthcare facilities, it is a mandate to have Weqaya. And also it covers prepackaged foods and menus as well. So what is a meal? A meal, as you all know, it has a main component, it has a secondary component, it has the siding. All of this need to apply the Weqaya specifications in them, as well as if like you go to a restaurant, you will see a buffet. It could be a salad buffet, also like a salad, because we know that salads are healthy. And as long as the dressing, because with salads we have a problem with dressings usually, as long as the dressing fulfill the requirements of Weqaya, then in that case it can carry the symbol. Okay, so what do we require from you? If you are a restaurant, if you are here with us attending, you need to have at least one Weqaya in each category. What I mean, one Weqaya in each category. Like if you have an appetizer, one of the appetizers should be Weqaya, a main dish should be Weqaya, a side dish should be Weqaya, and also a dessert. Usually in cases of desserts, it can be, I would say, like fruit salad. But also you can, yesterday we had a meeting actually with food outlets, and they are telling us how they can invent healthy stuff. They can do, like they were talking about Hollandaise sauce, and how they can change the butter into another ingredient, and this actually will help in making it a Weqaya item. The same thing when it comes to dessert. Dessert, like if you have, for example, mahalabiya, that's made with skimmed milk or low-fat milk. It's made with the healthy, not the sugar, but it can be like added monk fruit, or it can be Weqaya. And also date cake, for example. All this we can work on them. Now, this is in terms of dealing with the meals. The other thing, that the staff and the chef, they should be provided with training. Like if you are carrying a food, looking after a food establishment, please make sure that you do training to your staff. We were happy to do the training for you. We have workshops, 3 to 4 workshops every year, so you are always invited to attend. And also one of the main things that you need to train your staff on is doing nutrition analysis of menus and recipes. And now we used to use a lot over there on the web. Some of them you have to pay for, some of them are for free. There's Calorie King. I used AlaCalc for years actually, before we developed our own food analysis program. And we invite you all to use it. It's offered to you for free. You don't have to pay. And at the same time, once you analyze your food through our food analysis program, it will tell us that you are actually registered with us, you are a Weqaya entity, and we can look at it and tell you what are the changes that you can do to make it a healthy food options. And the other thing, that there must be a nutrition fact label. A nutrition fact label is a must. If you cannot have it on the food product, it should be available upon request. Like it is the right of the customer to ask you what is in my food, and you must have this available for them. And also there will be auditing, random audits. So it is very important that you keep a record, because you will be asked, if this is a Weqaya, show us how is it a Weqaya, what do you have in it, or what is the program that are using to analyze it to make sure that it is a Weqaya. Now, Here, let's go to the criteria. The criteria, as I mentioned, we look at obesity, so calories is very important. A main meal should be less than 700 kilocalorie. A side dish should be less than 200. Fat should be less than 3 grams of fat per 100 grams. Saturated fat less than 1 gram. Sugar less than 3. Now, actually, we even made it more rigid with sugars, and we're asking to be less than 2 grams per 100 gram of products. And salt less than 0.8 gram per 100 gram. And it shouldn't be added to any food that is have sweeteners or have additives or is deep fried. This is very important that you keep in mind. Now, we have criteria for meals, and we have criteria for individual foods. Individual foods, it can be applied to dairy products. And if you're interested, please send us, shoot us an email, call us. You will have all our information on SIAL site. You have our social media information. You can ask us about the individual food specifications, and we will be more than happy to share them with you. So they are low-fat dairy products. Bread should be minimum 5 grams per 100 gram dietary. And I told you earlier the importance of having fiber in our food. Sugar, we are more flexible with the sugar when it comes to individual items than when it comes to the whole meal. So I said that it should be for a meal less than 2 grams, but when it comes to bread, we accept less than 5 grams. Sodium, it should be half gram per 100 gram of products. And my friend will speak more about the bread and the salt in bread later. Now, when it comes to pasta, cereal, we care a lot about having our fibers in those foods, so it should be 50% whole grains. Cereals, now, the other thing that we usually educate the community, and we want you to be our advocates for it, that sugar, avoid sugary cereals. And if you are the producers of those cereals, make sure that you work with your formulas and you have less sugars in your cereals. The other acceptable item and a very healthy item is vegetable juices. Now, this is something that I would like to mention, that fruit juices are not Weqaya. Because fruit juices, no matter how healthy they can be, they have a lot of calories, they have a lot of sugar because they are condensed. But still, I can't say that they are a bad option. If someone doesn't have diabetes, that doesn't have a problem, and can consume those drinks, those fresh juices, of course they can. But we have smoothies. Smoothies can be Weqaya as long as they have a vegetable in it, they have a low-fat dairy in it, and they have a little amount of fruits, which means, which translates to little amount of sugar. Why are we doing all this? We're doing all this because we have a population goal. We want to make sure that our population eat at least 440 grams per day of fruits and vegetables. As I mentioned, they need to have their fibers. Their fat should be less than 33% of their total energy intake, saturated fat less than 10%, and salt less than 6 grams per person. So what contributes to healthful diets if you are in the food industry, or if you are a mom, or if you are a dad, anyone who wants to follow a healthy lifestyle, please concentrate on your fruits and vegetables. Make sure that you're having enough whole grains. If you go to dairy, choose the low-fat options. And fish is very important. Twice a week, fish has very healthy fats. Even with the Weqaya, actually, we exempt fish from the fat content. Because we know, like, for example, salmon. Salmon has vitamin D in it, has a lot of antioxidants effect, has omega-3, and it is very, very beneficial for health. So when it comes to salmon, we do exempt the amount of fat, and please make sure that you consume fish at least twice a week. And if you eat your meat, make sure it's lean meat. If you have your chicken, make sure it's lean chicken. And also, don't always try to get your protein from meat or from chicken or from fish. Look at beans, at vegetarian sources of luckily, our Middle Eastern diet is filled with hummus, it's filled with fool, with all those things that do have a protein in them and have fibers as well. So they're definitely very beneficial. Now, what is the reference amount? When you want to look at all these things that I've been talking about, how do you look at it? Do you look at it in the dish? Do you look at it in portion? Do you look at it in grams? Actually, usually, and this is the international standard, this is what we usually do, we look at it per 100 gram of the product. Some people look at it per portion, but very, very rarely that you look at it for the whole pack. So that's very rare that it happens. And in public health, it's not going to happen if we don't monitor it. Nothing happens without monitoring and evaluation. Consider it not done, unfortunately. So it's the same thing for your entity. You want to make sure that you monitor your work, you want to make sure you evaluate your work, and you want to make sure that awareness is always there. Why you're doing this, why not? What are things that are happening? Why are they happening? How you can treat them? How is the counter effect of those things? And so it's very, very important. The objective analysis that covers necessities, all of that is extremely important. Now, those are examples of our food outlets. We started in 2013 with 9 food outlets. Those are our pilot. As I said, monitoring and evaluation is very important. We worked with our partners at DEFCA at the time. Now it is the Agriculture Authority, and we worked with the Quality Conformity Council. And with those 9 food outlets, and we launched it on the 23rd of September 2013. And they came and they did a big feast at the Department of Health, where they showed their work, where they showed the nice food items that they were working on to make it Weqaya, and it showed very, very successful. Based on that, the program grew. In 2018, we have 30 outlets. And in 2019, we have 49 entities by last year. So this is a big increase. We have hotels, we have catering, we have restaurants, cafes, and we have hospitals. As I said, for hospitals, we're expecting the numbers to grow dramatically because it is a mandate. In 2018, there was a circular that was issued by the Department of Health that it is mandated by all healthcare facilities, their affiliated restaurants, food outlets, any food outlets that work for a healthcare facility must actually have Weqaya food items. Those are the names of the food outlets, and we will put their names. Like if you are a Weqaya, this is one of the incentives for you, that your name will be listed on our Abu Dhabi Public Health Center website, and this will be a great incentive for you actually, because people will know more about you. We can even link it to your address. We can even have your contact information. So please, if you're not registered yet with us, register, and we will add you to the list, and we will add you to our website. Those are examples of healthy Weqaya menus. As you can see, we had the first healthy shawarma in the Middle East. And so here's how they advertise for it: get happy with shawarma. And we compared the healthy with the unhealthy, and how it was less fat, how it was less salt. And so it was a very big hit at the time. And the same restaurant actually that offered the shawarma offered a super healthy grain salad. So even people, if they didn't want to have the meat, they could have the grain salad. And there are many other restaurants that, as you can see here, their menus, how they advertise for it. We have La Brioche, for example. They had a beautiful social media clip, and this is a screenshot from it that they showed that they are offering the healthy food items at La Brioche. This is from An-Noor Hospital at the time. Now it's Medi Clinic, and it is one of our pioneers actually who started this program with us. And I want to thank Amani Kamal, I don't know if she's with us now watching, but she was actually one of our ambassadors at Noor at the hospital at the time, and she done tremendous job in making sure that all the food items within the kitchen, within the cafeteria, that's offered to staff, offered to patients. And when I say patient, I'm speaking later about what is the importance when I talk about patients and when is it related or not. This is at Al Mafraq Hospital. Also, I want to thank Batul, the dietitian at Al Mafraq, who also was one of our major pioneers who worked tremendously. As you can see, they even had like a whole section, and they had the sign Weqaya above it, a whole part of their cafeteria that had only Weqaya food. What did they do at Al Mafraq? This is, they trained their staff, they did a lot of analysis, they even did tasting to their food, they did awareness, customer awareness, they did evaluation, and based on that, they were able to establish their Weqaya program. And this is from Fairmont Hotel. Fairmont Hotel, there was a great chef. Unfortunately, he had to leave Abu Dhabi. He went to, I think, to Saudi Arabia, where I'm sure he's implementing the same great work that he have done there. And as you can see, the Frankie's restaurant at the time, the whole restaurant had, all what it had was Weqaya food. This is from Royal Catering. Royal Catering, they went with traffic light analysis, and as you can see here, their food items were either green or orange, which means that they satisfied Weqaya or they were very close to be Weqaya. That's when it's orange, but none was red at the time. So they really, Pamela, the name of the dietitian who was working with them, and she was amazing as well. This is La Brioche, as I mentioned. This is the advertisement that they had for Weqaya. And now I said I'm going to talk about healthcare facilities. I hope that some of you are from the healthcare facilities watching. It is very important to know that it is a mandate. The circular came out in 2016, and it was voluntary at the time. Unfortunately, when it's not mandatory, it doesn't happen the way we want it to happen. So in 2018, our directors, our management, their excellencies, they advised us that make it mandatory. So we did send a circular to all healthcare facilities that it is a mandate that they have Weqaya at the hospitals. So, but at the same time, we didn't want to constrain them too much because they must have their challenges, they must have their issues. So we decided, okay, you can have 70% of the dishes Weqaya and 30% are flexible. The same, I'm not going to go into the specifications again because it is the same specifications when it comes to the main dish, as I said, less than 700, side dish less than 250. I said I'm not going to go through it, so I'm going to keep my promise. But actually, those I can send them to you later if you are interested. Individual food, the same. Like if you're selling milk at the healthcare facility, if you have like a little, let's say, what do they call it? Like a little fridge with all these items, you just want to make sure that they match the Weqaya logo. Even vending machines must have the Weqaya food in them. 70% of the items must be Weqaya. Lebni, breakfast cereals, all of those can be sold in a vending machine. And why not? They can definitely meet the Weqaya specifications. The same with the meat, with the vegetables, nuts. Now with nuts is a very healthy food item, but it is very high in calories. 1 cup of nuts can exceed 700 kilocalories, especially if it's macadamia or those kind of nuts can reach even 800 or 900. So it's very important that the amount of nuts is limited, like 30 grams, no more than that. They say to make it easier for the customers, like size of the palm. And just make sure that there's no salt added, and it's not fried, and it's just like raw or maybe roasted without any oils added. When we say healthcare facilities, we mean everything. We mean the cafe, the cafeteria, the vending machine, and everything that is affiliated. Can you imagine that someone is smoking now those days at the healthcare facilities? When the anti-smoking initiative started, people thought, oh my God, this is not going to happen. But now it is just people, we will never, like, it will look so awkward if you see someone smoking at a healthcare facility. It is the same thing. When it comes to healthy food, we want to make sure that no one is eating unhealthy. I don't want to name food. I don't want to give them a label, but we know what unhealthy food is, and we don't want to see that at a healthcare facility because it's not good for your image. If you are at a healthcare facility, it's not good for the customers. It's not good for the patients. We want you to be the advertisement. You are a hospital, so you want to make sure that you are advertising for the healthy food. So there are foods that are not allowed at all and not within the 30%. I mentioned that you have a layer of 30%, but not when it comes to deep fried fruits, food. It doesn't not apply to beverages, the fizzy drinks, energy drinks. It doesn't apply to donuts, Danish, candies. All of those, they're not allowed. Regardless, we can't even say they are allowed within 30%. But you can have meats if they specify certain criteria. You can have a popcorn if like the sugar is less than 15 grams per 200, and also if the calories per serving per 3 cups is 200 calories. If you don't have added salt to it, and if you have the healthy oil, not the trans oils that's filled with trans fat or the saturated oils within the popcorn, then yes, you can have it. Now, portion control is very important. And I said 30%. What do I mean by the 30%? 30%, it can be like, let's say, biryani. A biryani, like you have the healthy biryani within your 70%, but then within the 30%, if you have like a little bit extra of salt, a little bit extra of fat, we can allow it within 30%. So it should be the little portion, not the big portion. And the other thing also, trans fat is not allowed at all though. Like you can have it, but without trans fats. And if you use carbs, it has to be whole grain. Now, you can have these items because we all crave sweets. And if someone is healthy, every once in a while, they can have a little piece of cake, they can have a cookie, but those with limits. So within the 30%, you are allowed to have those at your healthcare facility, but it has to be with limited size. And as I said, no saturated fat, no deep fried, and so on. The other thing, and I can't emphasize more about healthy marketing. Just give you an example from our days now. Our days now with the COVID, as you can see, the oneness all around the world. Everyone is speaking about the same thing. Everyone is talking about masks. Why? Because the marketing. See how the influence of marketing can change people's habits? Did you ever imagine yourself walking down the streets with a mask on? I never imagined myself doing that. But now it's the norm. If I'm not wearing a mask, this is actually something weird. So it's the same thing when it comes to healthy marketing. So if we work hand in hand together, and if we work on marketing our foods in a healthy way, then it can happen. So through, like, if some of you are from the media, some of you are from TV, from radio, or any kind of social media channels, please emphasize on the healthy marketing. As I showed you, La Brioche, for example, and other partners as well. They worked with us, they had them on their social media. So it's very, very important. When you go into a healthcare facility or even into restaurants, instead of having the picture of unhealthy food, have a similar picture to what we have here in the background, the fruits, the vegetables. Now, actually, last but not least, we developed, as I said, an food analysis program. This is the interface of it. I want to ask the people who are turning my slides, can you try to make it work, this video? Would it work, actually? Can you play it, please? Yeah.
Actually, the media is not available on the presentation. Sorry.
It's fine. This is available on DOH website, and of course we are partnered with them, Abu Dhabi Public Health Center. So if you want one-on-one training on how to use this site, on how to analyze your food, we are more than happy to do that for you. Thank you so much, and I hope that this was beneficial for all. And I'll be with you later. I'll be talking about the calories on the menu, but now I will leave the floor to my colleagues. And if you have any questions, we are there. This is our social media info. Please send us an email. Again, my name is Arwa Al Modwahi, and I would be more than happy to support you with your healthy initiative programs. Thank you.